Well, as they say, health is wealth. Good afternoon to all our viewers and welcome to Grace Power TV. Today being the 2nd of December 2025, we are going to be educated more about M-Pox by our guest from Embakasi North Health Officer. I'm your host, Patricia Irinji. Our health officer, you are welcome to our show.
Thank you very much.
Kindly introduce yourself, start with your names, and tell us where you are from.
Okay. Good afternoon, viewers. My name is Jane Maderi. I'm a health promotion officer within Nairobi County, based in Embakasi North, Embakasi North and Kasarani sub-counties. I cover both sub-counties. Matters health promotion.
Okay, Officer Jane,
Yes.
please start by informing us and also informing our viewers what is M-Pox.
M-Pox is a viral infectious disease which is caused by a virus, as I've said. The virus is M-Pox, just as the name indicates, M-Pox. Basically, it came from monkeys, and ideally it was called M-Pox, but now we call it monkeypox, but now we call it M-Pox. Okay, it is very, very infectious. As you have heard, it started from monkeys and then it came to human beings. After it came from the monkeys, now the human beings, it is very infectious from one human being to the other human being. Yeah, and in Nairobi County, we are having cases in all our sub-counties. All the 17 sub-counties are affected.
Okay, Officer Jane,
Yes.
can you please inform us, can M-Pox be treated?
Well, M-Pox cannot be treated. What we do is we treat symptomatically. The symptoms that you are having, that is what is going to be treated. Otherwise, it is. We also give antiretrovirals. Those are the drugs that are given, and people can be healed from it, though it takes quite a while. Yes.
Okay, Madam Jane, as you continue to inform us, can you tell our viewers the signs and symptoms of M-Pox?
Okay. The cardinal sign of M-Pox is we have a rash, severe rash, and it is very symbolic because it affects both the palms and the feet and then the whole body, everywhere, the face, the eyes, the private parts, it affects everywhere. That is one of the cardinal signs. Okay, we have other signs and symptoms. We have like fever, we have headache, we have fatigue, we have body aches and body pains, which we call body pains. And then we also have enlarged lymph nodes. For the rash, I've said it is in the palms and the source of the feet and the whole body, as opposed to the rash that may be from chickenpox and measles, so you can identify it easily. Yes.
So, Madam Jane, in our current situation and in our current age, M-Pox affect which age mostly?
Mostly it is affecting the ages from 20 to around 45 years, and men are mostly affected than women. And we find that it has no age limit. It affects even children. Like we have the youngest child who was affected was an inborn, because one of the mode of transmission is mother to child. There was an inborn, but of course not in Nairobi County, it was in Nyeri County. So basically it has no age limit, but the ages that are mostly affected are between 20 to 45 years and mostly the male gender, men.
Okay, Madam Jane, because you deal with all sub-counties of Nairobi,
Yes.
can you inform us that how many people are affected with M-Pox in Nairobi County?
Okay. Within Nairobi County, currently, as of 30th November 2025, we are having 131 cases. Out of the 131 cases, we are having 82 male and we are having 49 female. Out of that, we have had one death from M-Pox.
Okay, and what measures can our viewers take to prevent themselves from being affected by this virus called M-Pox?
Okay, the measures that we need to take are very simple, and they are measures that as a health department we keep talking about, because they are measures that prevent even other diseases. One of them is avoid close contact. If you suspect somebody has M-Pox, avoid close contact with that person. And if you suspect maybe that that person has had contact with an M-Pox person, you also need to avoid that person. You also need to avoid sharing of personal items. Personal items in terms of maybe clothing, in terms of maybe towels. Those who share towels, we avoid using that. We also need to make sure that our hand hygiene is proper. What we said, you wash your hands with soap and water, not just plain water. When you are out there in the field, before you start anything within your household, wash your hands. If you suspect you've touched something that is not really pleasing to your hands, wash your hands with soap and water. We need to frequently wash our hands with soap and water, because you will not know whether you have touched a surface that has the virus or not. And then we also need to clean our surfaces, the commonly shared surfaces. We need to clean them with maybe detergents or disinfectants, so that other people cannot be affected or infected through that. We also need to have aeration within our rooms. Our ventilation also needs to be proper. Yes. Thank you very much.
So, Madam Jane, since you've told us and also our viewers that we need to wash our hands regularly, like we did in the time of COVID, so can you tell us, is this the first time that we are experiencing M-Pox in our country?
Okay, I can say in our country, the first case was diagnosed 2024, around July 29th in our country. But in the world, this is a re-emerging. These are the infections that we say re-emerging infections. It has been there because it was first recognized in 1958, that it was in Denmark. And then within Africa, it came to 1970, that was DRC Congo. And then from there, between 2017 and 2019, it went even up to Nigeria. So within Africa, it has been there. But in Kenya, the first time it came to Kenya was last year, that is 2024, July. And then from there, we have been having infections up to date.
Okay, you as health officers, are there a vaccine that you are going to immune people as you did with COVID, or this is just a virus that when you experience those signs and symptoms is when you go to the hospital?
Well, yeah, worldwide there's a vaccine, but unfortunately in Kenya we've not had that vaccine. But if the cases go higher, maybe the country will consider bringing in the vaccine. Otherwise, there's a vaccine, but within Kenya there's no vaccine, and there's no cause of alarm that we need to give the vaccine as of now. But if people don't take the precautionary measures that I've just mentioned, the cases will go up. You realize cases are going up day by day, because just last month we had a few cases. Now they are increasing. You've heard we are having 131 within that, and that is Nairobi County. So we are also having cases within other counties. So it is good that we take the precautionary measures so that these cases don't go up.
Okay, Madam Jane, in case of our viewers have not get the signs and symptoms well, so which are these common signs and symptoms, the common ones that a person can know immediately that he or she is affected with M-Pox virus?
Okay, what we say as the health personnel, once you feel that your body is experiencing some signs and symptoms, or something that it is not common and is not normal to you, it is always good that you go to the hospital so that you are checked further. Because some of these signs and symptoms are signs and symptoms of other ailments. Remember, I had said there is a headache, there is fever, there is sore throat, there are body aches, there is fatigue. This could be signs and symptoms of any other illness. But now, for you to know that really a person has M-Pox, there's that rash. The rash that is very unique. I've said it is unique in its way because it gets even to the palms of the hands and the soles of the feet, whereby the other rashes for other ailments like the chickenpox or the measles do not affect the palms and do not affect the soles. And well, these are also, and they are very painful. I tell you, the rash is very painful. One is not even able to step down, or you are not able even to hold something using your hands, and they are very painful. So you can imagine if you are having that rash within the whole of your body, this is very painful. Yeah.
Okay, does M-Pox virus have stages like cancer?
Well, we can say it doesn't really have stages, But what we can say that it has a period within which maybe you get the symptoms and maybe when you get healed. For example, we say the incubation period is from between 5 to 21 days. And within this incubation period, one could have the signs and symptoms or could not have the signs and symptoms. Or when I say incubation period, is that between the time that you get this virus to when the signs and symptoms come, that is when we say it is between 5 to 21 days. It can be any day between the 5 and 21 days. And then from there, between day 1 to day 4, that is where we call the febrile stage. That is when we call it the febrile stage. In the febrile stage, this is where you have fever, you have headache, you have chills, you have sore throat, you have fatigue. Of course, this you can confuse it with any other ailment. When it is at this stage, please go and see a health personnel, or go to a health facility whereby you will be investigated further. Our people in the community are used to going to buy drugs over the counter while you do not know what is ailing you. So it is important to go to a health personnel whereby you are investigated further and you are given the proper treatment. And then from day 2 to day 4 to week 4, from week 2 to week 4, you could have now that rash stage whereby the rash erupts from within your body. The whole body could be the whole body. And then between days to weeks, that is where you heal, depending with how the immunity of your body. People heal at different stages, but within this stage, days to weeks, there are those who can have all the signs and symptoms, and there are those who will have varied symptoms, not all of them together, but there are those who will have all the symptoms together. So it is good that when you realize you have any of these symptoms, you go to a health facility or you see a health personnel who will advise you further on what you need to do.
Okay, Madam Jane. So how long does it take for a patient to be treated or to be free from this M-Pox virus?
Okay, as I have said, depending with the personal immunity, we heal differently. There are those who will heal within weeks. There are those who will get maybe just the rash and then it goes off within maybe even days. So it really depends with the immunity of the person. And it is even very important to know the mode of transmission, because the mode of transmission is really important in knowing that when you come into contact with somebody who has had the M-Pox, that is when you get it. It can be through touch, it can be through kissing, it can be even through sex, it can be coming into contact with infected animals. You realize we said that it came from animals before it came to human beings. Maybe through skinning or maybe through even hunting for those who hunt. Maybe they can get it from there. And then also coming into contact with beddings of a person who has had M-Pox, or even using things like sharp needles, where a person who had M-Pox used the needles or the sharps. And then we can also have it from mother to child. A mother who is infected with M-Pox can also infect the unborn child, where that unborn child can be born with the M-Pox. And this, if the child is born with M-Pox disease, the rash will definitely be there to this unborn baby.
Okay, since M-Pox is a very dangerous virus, as to what you have taught us, the challenges that people that are affected with M-Pox virus, which some of the challenges that they face, can you identify them to us?
Yes, people with M-Pox have challenges. You can imagine when that person has that rash that everybody is seeing, people will stigmatize that person. They will not want to go near that person. Of course, you are saying that you should not come into contact with that person. But remember, this person needs to be taken care of. There are those who will really be sick. They will not be even in a position to come out of the bed. So they need to be taken care of. But once they are stigmatized, that is one of the challenges that they are facing. Another challenge they are facing that is, if this person is not registered with a health insurance policy, whereby you are not taking you are not, people are afraid of taking you to a hospital. Of course, because it is a pandemic, you are not supposed to be denied treatment, but people are shying away because of they're saying that no, we don't have money to go to the hospital. Others are saying that we don't want to come into contact with this person because we will get infected. So these are some of the challenges. And another challenge is that people who are sick also stigmatize themselves because of the way they look. They don't want to go out or even to talk and say that you have M-Pox. They will not really want people to know. Maybe they'll close themselves indoors. Of course, there's the isolation part of it. It is good you isolate yourself, but as you isolate yourself, let somebody know that you are ailing, and in case you need anything, they need to come and see you.
Okay, does these M-Pox rashes, do they itch?
They are very itchy and they are very painful. Itchy and painful at the same time. So you can imagine how comfortable a person with M-Pox feels. Yes.
Okay, so Madam Jane,
Yes.
what can you tell our viewers, those who have these patients that are affected with M-Pox?
Okay, number one thing I would want to tell them, number one, just show them empathy, have concern for them, because they are our sisters, they are our brothers, they are our parents. You need to take good care of them. First of them, let them first go to the health facility where they'll be taken care of. And from a health facility, there are those who will be told that they can do self-isolation. Depending on where they live, they can do self-isolation within their houses. Please just assist them with whatever they need to assist. All that you need to do is take precautionary measures. You can use protective gear when you are taking care of them. And again, if you, we need also to tell them that if you suspect that somebody has M-Pox, it is good that they don't hide. Let them go to a health facility so that they can be advised on what to do. Yes.
Are there types of food that these people that are affected with M-Pox are supposed to eat, or they just eat normal food like others?
Okay, it is good to eat normal food like other people, but remember we need to eat food from all classes of foods. Earlier on, we used to say balanced diet, but now we are telling people that eat food from all groups of food, whereby we have energy-giving foods, we have food, we have vitamins, we have even water within that food, we have bodybuilding food, all classes of food, so that at least your body can also build up immunity towards the same and to any other ailment that you can come across.
Okay, Officer Jane,
Yes.
thank you so much for your time, and we are glad that you visited us today at Grace Power TV. Our viewers, you have heard all the signs and symptoms of M-Pox. Kindly wash your hands. Kindly do not share clothes. Do not share towels. Be protective. And always, 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 the main point and the basic point is to always wash your hands with a soap. Stay tuned in to Grace Power TV for the latest news and information. Thank you so much.